Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. How are you guys doing? Happy Tuesday. Welcome to the show. My name is Abby Tyler. I am your host. As you can see from our topic today, we're going to be dealing with pediatric patients who should be children between the ages of 0 to 18 years. Okay, mostly going to be talking about the school age children, younger children today. Okay, so the topic of the show is cold symptoms when to call the pediatrician. So, as always, my disclaimer, I am a provider, but I'm not your provider. So, whatever I say here should not take the place of you following your own doctor's orders. And also, don't check with your children's pediatrician as well. Okay, and for those of you who don't go to pediatricians per se, general practitioner, or make sure you check with them first. Do not that's my disclaimer. So let me start here let me just make sure I have this here. Okay, so I will start with this show. Okay, so let's go in there. It says cold symptoms at this time of the year. I mean, right now you watch the news, and so many kids are in the hospital because of the respiratory viruses and all. And there's sometimes a cold is just a cold. You get a cold, and with younger kids, you're gonna get a cold. They're gonna be passing it back and forth, back and forth. In the past couple of years, we didn't have too many outbreaks because children were wearing the mask, so there wasn't too much the flu going around. It was going around, but people weren't getting as sick. They weren't getting as sick as they are now, and also just regular colds. But with children, with their immune system still is immature yet, so as they get into the point where they're just going to go back and forth, get back and forth with the viruses. And if they're in daycare, especially in daycare, even when they're home, they're also in contact with their older siblings, other people who come into the home. So they're going to get it. And that's supposed to eventually make your lungs strong and you stop fighting, bringing up your immune system so you can fight bigger things as you grow older. But there are times where a cold is not just a cold and you start getting worried. And as a parent, you're like, okay, am I supposed to call my pediatrician, and am I supposed to call my child's pediatrician, or am I supposed to, just wait it out? Just wait it out and see. I don't want it to think that, okay, I'm just panicking. I don't want to seem like this mother or father who calls for every little thing. And they're probably going to be thinking, I'm just panicking. I'm overthinking it too much. Or maybe some people would say, oh, well, we all got cold when we were growing up and we got and better in a couple of days and all that too. So don't worry about it. So it's like at the same time you'd be like, oh, well, I'm watching the news and a lot of kids are in the hospital because of that. So what if I don't take the time and call my kid's pediatrician and I just say, oh, just let it go and something serious happen. I'm going to live with that guilt forever if something happens to my child. So what do you do in that case? So again, when you have a cold symptoms like the runny nose, stuffy, and especially if they come with history, if they have like asthma and other things like that, they have a higher chance of getting sick over and over. But so, and those things kind of last like maybe a couple of days. So like in 7 days to a week, you if they have fever, you treat the fever. If they have sore throat, you treat the sore throat. So this is what we call supportive care. But at some point, it's like, okay, they look like a little bit sick, then they're small, than they usually are. So when am I supposed to call the pediatrician now to worry about that? So this is how you're going to be thinking about it. Okay. So again, of course, you can call the pediatrician anytime. You don't say, well, these are the set guidelines that I have to follow. Okay. So like again, like start again, we're in flu season and I already talked about all the things that you have to look forward to, having younger kids in school and having being exposed to that as of course as parents too and guardians of younger kids. They're going to give it to you. You get well, this other person gets sick. And the thing about it, when you have children, you don't all get sick at the same time. Most times they don't all get sick at the same time. One would get sick and the other will get sick. And I understand if you live in places where you have to work and you don't have a babysitter and the child's sick, you can't send them to the babysitter, so you have to stay home. So there can be a lot of days lost from getting wages and all. It's not saying, okay, if my child is sick, you worry about getting paid. Yes, because you have to pay the bills and you have to keep your job in order to continue with the health insurance. So I'm just being realistic here. And that's not saying, oh, you don't love your child or you don't do this. Everybody knows that if you parent and you work and you have to work, okay? So the most important thing is to making sure you keep your child healthy and knowing when your child needs to stay home from school or go to the doctor's office or be sent to the emergency room. So right now, like I said, cold and flu season. So one of the most important that a virus is going around is called RSV. Okay, so people are saying what's the RSV virus? It's respiratory syncytial virus. Pronounced differently. It's a common, highly contagious illness that often causes mild upper respiratory infection. So you feel it mostly here, and you're coughing, congested cough, and all. Okay, the similar symptoms are similar to a cold. However, in infants and very young kids, and sometimes the older adults who their immune system, because as you get older, your body cannot fight off infection and all that. That's the reason why I always tell people to get get all your vaccines that you're supposed to get. Okay, and older patients and patients with weakened immune system or certain underlying health problems. RSV can cause serious lower respiratory illnesses because when it goes deeper down into your lungs and all that in the bottom part of your lungs, that's when we start worrying about pneumonia and all that. And like I told you guys, there are times where yes, you can put Vicks on all you want, but if that virus or bacteria is like in the lower part of your lungs, you need to get. Sometimes you may have to get IV antibiotics, as opposed to just giving the IV antibiotics, as opposed to giving the pill form or the capsule form of the antibiotic. Okay, so some of the warning signs you have to watch out for. Okay, so symptoms of the RSV, and also this can also run the gamut with cold and flu, and now especially with COVID. So it's always best to get tested too. So I think a lot of people have I think we were all given 4 COVID tests, so test at home. So you can also test at home. At least you're ruling that out of the way, especially if you have kids with heart disease and asthma and other autoimmune diseases too. That making if they get sick, they can get really, really sick. So that's always important to make sure you get the COVID out of the way first. Okay. So some of the symptoms you want to look out for: high fever. Okay, anything like greater than 102. If the kid's younger, much younger, anything greater than 100. Fast breathing, where if you see them sitting there and they're just resting and they're breathing, you breathe in and you breathe out normally. But if you see them breathing, like they're not taking any like pause in between their breathing, you want to keep an eye on that. Coughing persistently because that means the lungs not clearing out. Problems feeding if they're still breastfeeding and they're having a hard time latching onto the breast, or also even if they're bottom fed and all that, they're stuffy and they don't want to eat. And if they're younger, they don't want to eat normally. You fix their regular food and they don't want to eat and say, okay, we have a cold, you have to eat something. Sometimes you want to make like a nice little pepper soup or stew or something, like nice something warm and all, but you find that they're not eating that because you want to give anything heavy at that time. You want to give something light where they can take that and make sure you keep them hydrated. So if they're not eating, you don't see they don't have any appetite and not completing the food, that's when you want to start getting concerned about that. Again, like I said, when people say stuffy nose and they're talking and they sound like they're talking above here, very, very heavy congestion, check with that. And important apnea. We'll talk about sleep apnea before my other video. This one is like when you see them and they're like laying there and they're not breathing, like you're literally looking at them and they're not breathing. You're looking and you're like, okay, you're not breathing. It's like 5 seconds, 6 seconds, 7 seconds. You're not breathing. You want to call 911 right away for that one. Okay. So even though the infants are like considered high risk, some of the groups that can, high risk for getting very sick. Okay. Premature babies who are born way before the time they're supposed to be born. Especially if they're sick in the hospital too and all that, you want to get a check. Infants younger than 6 months old, that's a very critical time for babies and all that because their immune system is so very immature at that time. So anything less than 6 months old. That's the reason why when I see people going out and to parties and like a huge party or things like that, and they have their babies, really young babies and all. I mean, summertime sometimes because it's hot, so you're not getting the cold virus is not there too much. But very young babies, keep them home. Okay, it's not important for whatever party. You can tell them you can't make it. Okay, especially when you go in somewhere where it's inside too, and everybody's breathing around this poor baby. No, don't do that. You don't have to be there. Okay, or find a babysitter, or just don't go. Okay, that's some of the things we have to sacrifice as parents, especially we have very young children. Okay, children younger than 2 years old with chronic lung disease, lung or heart disease. Again, like I said, with asthma and all those other diseases. Children with weakened immune system, if they have autoimmune, especially if they have diabetes, also like that would be type 1 diabetes if they're very young. children with neuromuscular diseases, any kind of heart disease, like they were born with any kind of congenital heart disease, as disease they were born with, and anything going on with the lungs or any kind of chronic lung disease, cystic fibrosis. Even if you find out it has sickle cell anemia that like I spoke about before, that can also make them very sick. So you want to keep an eye out for that. Okay. If you have children that have those diseases, it's not limited to that. But if they have those diseases, keep an eye out. Okay. So a cold cannot just be a cold with that population. So went to seek immediate intention. Also going back, adding a little bit more to that. Call 911 if they have the nasal flaring. When they're breathing, you see that nose, going wider than it's supposed, because you're supposed to be breathing, and your face is not supposed to feel like you're trying to catch air, like you're trying to get the air in or get the air out. You see that nose flaring when they're breathing. Call 911. Difficulty breathing too. If they're breathing and they're breathing very hard, and you can feel like they're using all the chest muscles, okay, to breathe, just to get the air out. We'll say using the accessory muscles, using all of that just to get the air out. You want to get that straight to. That's the reason why sometimes I say if they're really sick, then you probably have to stay home with them, because, or an older sibling, they're staying home, a responsible older sibling. Most places legally they can have to be over 12 years old. But if you have older siblings that you know are not mature enough to have that sick child at home, you have to find other alternatives. Okay. Let me go back here and retract on. Let's say if they're breathing, and you see sometimes, most of the time, they have the little t-shirts on, the undershirt on, and they're breathing, and you see the little rib cage. I'm like, and they like the retract. It goes into where you can see, and they say, "Oh my goodness, I can see your bones. I can see your ribs when you breathe. Look at that. Look at that." You definitely want to call 911, because they're literally cannot breathe, and their little bodies really struggling to breathe in that point. So you definitely want to call 911. If you're somewhere where there's no 911 system, you will have to get in the car and take them to the hospital as soon as possible. Okay. I'm talking about places. Some places don't have 911, and most of the places I know now in America do. But also I make videos. My videos go out to people outside America, and other places that don't have that too. So you would have to really take them to the doctors right away. Okay. And if they're grunting like, definitely call 911. If they're very sleepy, with the sleeping, when they have a cold, that's fine here and there. But if you find them like you can't get them up, and you get them up to eat, and they're falling asleep, and they just don't have any energy, call. If they start turning blue, their hands, their nails, and their eyes, and everything. If you're, brown skin, dark skin person, they're looking kind of dusky, but you naturally tell that their hands and everything is blue, and the lips and everything look like it's really. If you're black, is purple. It won't be this purple now. So you know what your child looks like normally, and they start looking like that. That means their body is not perfusing the blood and the oxygen in the bloodstream to keep the body going. So make sure you send them. Okay. And if they're very anxious, agitated, and I'm like, again, your children, when they're acting that way, something else more is going on. Because when you can't breathe, I always tell people, and I always tell that to the nurses that I trained, and to anybody, and even my patients, if you cannot breathe, nothing else matters. And with other older children too, even if they have, because it's not just younger kids, it can also happen to older kids too. So some of them who like dabbling in vaping and all, I tell them vaping is really bad. You're literally opening your lungs, and you just pouring stuff right in there. Okay, so that's also very bad. People who smoke around children, to this also applies. So if you have your child has a cold, please do not be smoking around your kids. Some people say, I don't smoke around my kids, I smoke outside. Even if you're smoking outside, the scent is still on your clothing. Okay, so that's also neurotoxic. So the child is breathing that scent in, and smelling that for year in, year out. That if you have a child that has respiratory issues, even if they don't, that can also have a problem on their development as they grow up. So don't say, okay, I'm not smoking from my kids, I'm just smoking, or I'm smoking in the car but the windows open. They're still being exposed to that, because their little lungs is like still trying to mature, right? And sometimes you can call the doctor's office and say, I'm a little concerned about my child, and they might say, okay, bring them into the office, we can take a look at them. But there'll be times where you would just, and sometimes the doctors, if you don't answer, and if you call after hours, they would tell you, if you think your child's having an actual emergency, go and call 911, or go to the emergency room. Do not wait until the child was feeling this way, and you say, you know what, they're not in the office today, so I'll just wait and take them there on Monday or Tuesday or whenever I'm off. Do not do that. You know your child, and you know what's different about them. So if that's happening, I just told you all the different symptoms to watch out for. Take them to the emergency room. That's not a cold. You're way past a cold at that point. Okay. So again, high or persistent fever. If they had a fever in the morning and you give them some of the medication, it would be acetaminophen or ibuprofen, depending on the medical history at all. Check with your doctor. And the fever doesn't break, like over maybe over a whole day, and it hasn't broken yet. You want to get checked on that. Any breathing problems, I told you, faster labor breathing, persistent pain, ear ache. Sometimes you feed them, you see the little ones, especially the ones that can't talk, or the very younger too. The very younger ones, they will be holding onto the ears or saying they can't hear, or even you notice if you're talking to them and they're not talking back to you. You want to do that because also it's not just the respiratory issues too. You want to make sure nothing else is going on, like any kind of brain infection that may be going on that could also completely destroy the hearing or cause them to become hearing impaired as they get older. So you want to get that checked. Okay, if they're laying around and they're stiff and their neck is stiff and they're just laying around and feel really rigid, whatever you do, whatever it is that you have planned, stop immediately and call 911. Okay, you do not want anything that's going to infect their brain. Okay, so they're laying there, so I'm trying to move them, and they just there and stick neck, and they got the fever and all. And what do you think? Just go, just bypass, or just call 911 and go. You want to be that parent that they're going to say, "Oh, great, she's panicking again." You want to panic, as opposed to saying you should have done something and you didn't. Okay, because if your child, a baby or a young child, is not supposed to be laying around with a very stiff neck. It's not supposed to be laying around with fever that hasn't broken for over 24 hours. It's not supposed to be laying around very sleepy or and having problems breathing, and you get in a nice little soup or give them something nice to eat, and you're giving them fluids like they tell you to do some Gatorade and all that, because it has electrolytes in it that they need that, and nothing's happening. You want to send them, but especially with like stiff neck and things like that, breathing, like it's like grunting, you see that nose is flaring and all, call 911 right away. Do not sit there and wait, and don't feel bad that they're going to say you just panicking. Do not do that. Take mother, father, guardian, take call 911 and send them to the hospital right away. It could happen like that. Things could go wrong, irreversible, just like that. Okay. If they're having any kind of eye discharge, thick eye discharge, you're supposed to have regular stuff coming out of your eye. If it's really thick and it can open the eyes and all that too, because all of that, when you're having a cold, very bad cold symptoms, you start having like conjunctivitis, and that's mainly from like the cold and all that, like your conjunctivitis. If it's like pink, of course, you don't want that bacterial conjunctivitis. You want to make sure you take them, and the eyes really pink eye, that's very contagious. Send them to the doctor's office. They'll probably call for that. They'll probably say, they'll do telehealth. What we do now, we just call the doctor, call them on the phone, on the video phone. We look at the eyes, because usually you don't want to bring them in the office, because little in the waiting area, the little kids are playing around and they're doing this. If that's just that, if they have severe fever and everything else accompanying that, then of course you want to call and say, okay, yes, I want to bring them in, or take them to the emergency room. But anything that's really infectious, they will tell you. And especially now, we also got the COVID season going on, so most waiting room, they still don't want it to be completely packed anymore. So they're scheduling people far apart, and also the waiting room can also be your car, because they may just say stay in your car until we're done and we'll come and call you. Okay. So eyelids and not getting, if you clean the eyes in the morning and it looks like it's so draining heavily during the day, call. All right. And also frequent vomiting or diarrhea, one emergency room. Okay, because the younger the child is, even if you're much older, and older child, and they're vomiting and diarrhea and all that, either it could be a stomach bug mixed with that, or also the fact that something else going on and you don't want to become dehydrated, because when they become dehydrated, that also can cause other problems too. So send them to the emergency room, or your doctor may say, okay, this is what I want you to do. You can try it again and increase the fluid intake. We can give you some medication to help with the diarrhea, but if you have like diarrhea, maybe you go 4 to 5 times a day and it's really loose and it's like literally coming out. If there's any blood in there too, red flag, red flag, red flag. Call the doctor's office so you can go get checked. Okay. And I already talked about the stiff neck. So exposure to any contagious, like again, if they're exposed to anybody else in the house, and chicken pox and all, call. Chicken pox is also very that. All right. So, and they have any urinary symptoms and all, like they're not urinating, they're supposed to peeing. They're not peeing like they're supposed to be peeing, and they're holding it, or they're complaining of burning sensation, all of that too. That would not be considered emergency, but you can have that in addition to that. you want to call. All right. So what you're saying, what would be considered high fever? Okay. So if this is sometimes we usually ask, we'll say, okay, the patient's having a high fever. So yeah, my daughter's having a high fever right now and her temperature. I'll say, what is she doing? Is she playing around? Is she moving around, watching TV and doing things, other things that she's supposed to be doing and playing around? You say, yeah, even though she's 6, but she's moving around. We'll be like, okay, that won't be considered emergency. Just continue doing what you're doing. And all, like I said, treat the fever, increase the fluid intake, making sure they're getting some food in between there a little bit, even if it's dry toast and banana and all that, to let them do that because they won't want to be able to eat anything heavy. So keep on doing that. But if they have a fever and they're just laying around, that's an emergency. Yes, they need to come in to get checked or go to the emergency room. Okay. So we'll go in here for newborns. Just go in here and see. Okay, so what can you do at home to make sure your child gets plenty of rest? Like I said, that for younger ones, okay, any fever greater than 100.4, all right, Celsius degree, no Fahrenheit. Sorry, we had to convert when we're back in the hospital. Okay, so those of you who use Fahrenheit and those of you who use Celsius, just convert it. Most thermometers now they have it. So the first thing you want to do too at this time of the year, making sure you have your digital thermometer at home. So don't get the ones that you have to shake like that to see what it is. Do not do that because the child can easily bite on that, and you don't want that mercury, that poisoning go into the bloodstream. So get one of those. They sell it at any drugstore. They sell it at Walmart and all those different places. They're not that expensive. Make sure you have that on hand at home. Make sure you have your ibuprofen at home. Make sure you have your acetaminophen at home. I'm not calling the brand name right now, but ibuprofen is also Motrin. Acetaminophen is Tylenol. But again, you're going to be checking with your doctor to make sure because again, we're checking for the medical history. So they may not be able to get those things. And also if they have some GI issues with the Motrin, you don't want to give it to them at all. Okay. So, and also make sure they're giving them medications. Don't just go medicate them based on, okay, well, I'm this age and I can take this. So my child is this little, I can give them this half of this. Kids are not little adults. It has to be children's dosage. Okay, so don't go giving them regular. They usually start giving regular dosage when they're 12 and above. So if they're much younger, you want to call and make sure you talk with with the pediatrician first to see the doses of the medication that's safe for them to take. Okay, don't, like, again, children are not little adults. You have to give it according to the body. Usually when we do medications for little kids, we have to weigh them, and see it, and we dose it based on their weight and all. So that's very important. All right. If the child's uncomfortable and all that, if the child's like, because some kids, you'd be like, I don't want to go to school today, and I don't want, and you can say, okay, well, you can go to school, you'll be fine, and you'll be okay. But if they're really uncomfortable and they don't want to, you don't force them to go to school. Let them just stay home. They can watch the TV and have the little sometimes it doesn't have to be Gatorade, by the way. So you can also give them just popsicle to help with the fever too, and also help with the dehydration, prevent dehydration, so they can stay home and just have their little teddy bear or their little game and let's sit home. 24 hours won't kill them. Okay, I understand the working issue. I understand that we had this problem was going on during the pandemic when parents had to work. Some parents have to work. You can say, oh, this and this. Some parents have to work, just like how the nurses and the doctors and it is the other people who have to work too. So imagine if you're a nurse or a doctor, somebody who work in the field where you absolutely have to go to work. You have kids too. They just have to be understanding, but if they can stay home, that's okay. And, best thing for them to stay home and get enough rest and also not to spread it to anybody else too. So that's most important. Okay, so I already talked about the high persistent fever, vomiting, and all that. So when you go to the hospital, they're going to check in. When you go to the doctor's office, we're going to ask you about the medical history. We're going to ask you about the signs and symptoms and how long have they had the fever and what other symptoms are you looking for? Is it keeping them up at night? Are they coughing more? Do you see them phlegm coming out with the cough and all? What is the color of the phlegm? That sometimes it can be little girls to explain it, but we'll say is a white clear color. That means it's not too bad. If is it yellow? Is it dark? If there's any blood in it, is it pinkish? Is it green? That's always how to know and say, okay, let's see how bad the infection is. Okay, so all of that. Is it really thick? Does it feel like they can't get it out of their throat when they cough? Is it stuck here? Are they having any back pain? Are they having any rib pain? Also, all those things we'll be talking about. And then we can also, when we get to there, if they're very bad, now they go to the emergency room. That's when they have to swab you, and all in the doctor's office, they'll probably swab you again, making sure nothing else is going on there. And don't forget, all around this time too, you could be having sore throat and other things like pharyngitis and other things going on. Okay, so they'll do the PCR test too. That's the one that go into your nose there, your COVID thing, and that can test for other things too. So not just the coronavirus, and if they rule out the COVID, then they can treat the other things and go from there. But it's important that you stick your child to the hospital. If your doctor said go to the hospital, go to the hospital. Okay, so for most of the treatment, again, if it's fine, you go the regular thing, treat the fever, feed the cold, feed the cold, feed the cold. But most important, just like hydrate the cold, hydrate the patient, hydrate the child, because they're so quick to get dehydrated when they're very young. Okay, and they may have to get in some antiviral medication for the cold or the flu. They may have to get in some steroids too, especially if they're wheezing and other things. They may have to get some, breathing treatment and a nebulizer for those of you who have asthma and things like that. Not just the inhaler, but also the one you plug in and then put the machine in, put the droplet in there, and then put it to the nose. My daughter, when she was younger, she had a cold. She's like she had a cold, so we had to give her the nebulizer treatment. So you have to put it to the mouth and sit there and breathe for 10 minutes at least. It was hard to keep her mouth sealed over there anyways. So what she put it in her mouth, and I'll say, okay, put it in your mouth. Let me run around, go do some stuff. And next thing I'll come, she'll be laying to her stuffed animals, and she'll have the stuff and she'll put it in Elmo's mouth, and then all the medications in Elmo's body. And she's like, oh, feel better now, Elmo. And I'm like, okay, you were supposed to get. So basically, we had to stay there and watch her get her breathing treatment because Elmo got it, Big Bird got it, everybody got it but her. Okay, so I mean, little kids, and she's like, I just wanted to feel better. So I'm like, no, you have to feel better first before Elmo can feel better. Okay. So and then it's like when you're done with that, you make sure you wash your mouth, gargle a lot too, and make sure you don't get an infection in the throat, because from breathing treatment you can also get infection in the throat. So how do you prevent this? Okay, so some of the ways to prevent this, especially with little kids, again, like I said, making sure if you have very young kids, don't have so many people in the house. Don't take them to places that they don't have to be. Do not take them to places where they don't have to be. And people come into your house to this day, I still have my hand sanitizer at my front door and at my back door. And when I go to anywhere, I always have hand sanitizer there. If you go to places where everybody's going to be eating, and make sure there's hand sanitizer there, or have it in your bag. People think because there's no COVID anymore, so they don't have that. Remember, they're older adults. They're regular adults who have diabetes. That makes you higher susceptible to really bad respiratory infection, to flu, and all that. Those people who have lung disease, heart disease, so many other things, other autoimmune disease that weakens your immune system. Okay, so also there are people fighting cancer, recovering from cancer, or inactive cancer. So those people have to take extra care too, and also don't be around too many children that have the little nose running back and forth, because you again, like I said, people go back and forth. Kids bring it home. The parents get sick. The parents get well. Send it to the next child. The next child give it. And most times, everybody's not sick at the same time in the house. So that can be a little, when you have to work, you have to work. Okay, so it's important that you prevent yourself from doing this. Okay, so wash your hands thoroughly and frequently with soap and water. Do have a video before. I had that on my other group there, where I show how to do proper hand washing. Maybe I'll put that on this site. Avoid close contact with other people, especially if they're sick. Don't shake hands. This is the time of the year where you don't have to shake anybody's hands, unless if you absolutely have to. And I don't see any reason why you absolutely have to. If you own some program, but if you have to, you have your hand sanitizer, and they may feel a little offended. You'd be like, I'm just trying to protect myself, and I'm trying to protect my family as well. Okay, do not use share utensils or cups. If you're eating and you're feeding a little child and all that, please do not share the same spoons and all utensils with them, because you're just passing it on to them back and forth. You're just going to make them sick, and you're going to make yourself sick also. And do not share things with people outside of your home either. So if you have a cold, don't go be kissing on anybody, and the person should be kissing all on you too, because you're just gonna be passing it on to each other, unless that's the way show your love. Little kiss on the cheek here, and be like, okay, babe, I love you, but we're not gonna be kissing all that. Don't breathe in my face either. That's not love. Don't breathe in my face, because I don't want to get sick. I mean, sometimes it may sound a little insensitive, but you don't want to get sick too, okay? Because you both come in with your own pre-existing conditions as well. All right. Avoid touching your face until you have washed your hands. For those of us who wear glasses, we're always doing this and fixing that. Always, don't touch that if you have to do that. And again, you don't shake people's hands, so you don't have to, wash your hands, but have your hand sanitizer close by. Regularly clean and disinfect household and work surfaces, especially the doorknobs in the bathroom, on the toilet lever, the toilet seat, anything, your car, your steering wheel, especially your steering wheel. I have my own hand sanitizer in my car too. So when I touch the door, or when I touch the door going into the office, or touch the door going into somewhere, if I come out of the supermarket or wherever, I have my little hand sanitizer there. I just put that there and put it on. If I have food in the car I have to eat, everybody gets hand sanitizer before they eat. Okay. So, but try as much as possible, make sure you have that. And some people might think that you're being a little paranoid and you think clean free. Hey, you know your body, okay? Everyone in the household, including infants 6 months and older, make sure they get the flu shot. I know there's not a lot of people saying, okay, I'm either going to get the flu shot or I'm get the COVID shot. I'm not going to get both. You're supposed to get both because they're both, even though they're in the same family, they're different kind of viruses, okay? And the flu virus is like changes every year too. So you want to make sure that you get, if your doctor tells you that you have these risk factors, even if you don't have those risk factors, but it can help keep you from going into the hospital. It's not 100% proof. So when people sitting there and start saying, oh, this vaccine doesn't work, that vaccine doesn't work, and this and that, nobody said anything was 100% effective. Nobody. It just helps minimize the chance, decrease your chances of you having to go to the hospital. And which is important because you don't want to go to the hospital and you'll be away from your family. You'll be losing wages. You may get sicker because you may pick up other diseases that's also in the hospital. Okay. So make sure anybody who touches your child, especially if they come into the house, well, let me see the baby. Let me see the baby. No, no, that's okay. You don't, no, no. Or if you touch the baby, make sure they're not kissing the baby. They shouldn't be doing, nobody should be kissing the baby on the lips anyways, because there's so many different things that can pass. Some people who have the baby have peanut allergy and you may not know if they kiss that baby. Nobody should be kissing the baby on the lip anyway, besides the mother and the father. Okay. So, and if you're adult and you have a cold, don't kiss the baby on the lips. All right. And keep your child away from people who I talked again about firsthand smoke and secondhand smoke. Firsthand smoke, that's them. Secondhand smoke, people smoking around the house. All right. So bottom line, let me just make sure I covered everything there. And preventing I told you prevention, make sure you get your virus, you get your vaccine and all. So bottom line is you know your child. You know your child in and out. And you know how when they have a cold and they just run around and you say, okay, but something will tell you that this is not right. Okay, this is not my child. Usually when she's sick or she has a cold, usually when he is sick, you have a cold, they'll take their medicine and they'll run around and they'll be fine. And in 7 to 10 days, 5 to 7 days, they're fine. And some patient family member or parents will, I need antibiotic. I need antibiotic. You don't need antibiotic for a cold. Okay. Viral infection, you don't need antibiotic for that. The antibiotic is not going to do. You say, well, I took the antibiotic and it felt better. They were going to feel better regardless. Okay. So you don't want to expose them or you don't want to put them on an antibiotic that eventually they're going to build a resistance to and you can't use it because it'll be like simple antibiotics and we can't use it because they've already built this resistance to it. And sometimes a lot of doctors in certain areas, they have resistance, in that area. So they don't have to get antibiotic if they have a cold. They would probably have to get something viral. But again, like I said, treat the fever, feed the cold, hydrate the child, keep an eye on the warning signs that I talked about. That you can go back and watch this video again. But you know your child and make sure you're doing everything. And if the hospital or the doctors or your doctors or if it's a pediatrician saying, I know they're gonna be thinking I'm this and I'm really worried about my child. If you're worried, stick your child to the emergency room. Don't and you say, okay, well, they will still see me next week, or they'll see me in 2 days. They may say, okay, after hearing everything on the phone, because there's some, they have like their own triage on the phone, tell you, okay, let's ask these questions and all that. Okay, she sounds okay. Let her stay home for a couple of days. And if she's not better, you can bring her in. Or let her stay home for a couple of days. If it gets worse, go to emergency room. Okay, so you know your child, you can watch them and see what they're doing. If anything's changing, you go ahead and get that done. So a cold may just be a cold. A flu may just be a flu, or it could be something very dangerous that could lead to very bad lung disease that can lead to very poor outcome for your child. Okay, so it's important that you watch your child. It's important. Most important thing is prevention, prevention, prevention. Make sure they're getting all the vaccinations, making sure they're keeping up with all the doctor's appointments, trying to stay healthy, trying to stay active as much as possible, eating healthy, all of that, fruits and vegetables, and all of that we keep them, make sure that we keep them healthy. So if they do get sick, their body will already be healthy in order to fight that. But if you have a child that has some autoimmune diseases, things like diabetes and asthma, and all, this time of the year can be very rough, very, very rough on them. So you have to take extra precaution to protect them and protect other people in the house. Okay. So I don't see any questions here today. If you have any questions or comments, please leave them below. I will answer. I will answer them as I go on when I go back and read the comments and questions. And if this video have been helpful to you, please, 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 please share and also give me a thumbs up and the like button or the like whatever reaction, just put it there. Okay. And if you guys have any topics that you want me to talk about, eventually I'll talk about that. But I'm going to also, for those of you in Liberia, there, I'm not sure if they already passed it, but they do a free mammogram somewhere. So, but I'm going to plug that in the bottom of the comment section. So please give me a thumbs up. And also, don't forget, I'm trying to get up to 1,000 followers by December. Okay, so if you can just get, you can invite other people, and please share the show. Please share the show. For those of you watching on Focus on Liberia and all that, I do post other things during the week on the page itself, Abby Tyler's Healthy Living page. So follow and also get information during the week. I make these videos on Tuesday, and then I do healthy Friday chat with Abby on Fridays. And also for those of you watching on YouTube too, you know, join because I also post something on Facebook. I know some people on different forums that like to, especially on YouTube, don't come on Facebook anymore or whatever it is. So, but good luck to all of you. Please stay safe, and we'll get through this flu season. I noticed in the winter months are going to be really bad this year, but we'll do the best we can. Okay, as parents, I understand. I understand fully well that sometimes you can't take off if your child is sick and all that. So the most important thing is for prevention. But at the same time, you want to make sure that your child gets the care that they need if should they get sick. All right. So thank you all for watching. For those of you who are watching with me now, I say thank you. For those of you who will be watching later, I say thank you as well. And enjoy the rest of the week. And I will be back on Friday with Friday Chat with Abby. Okay. Thank you for watching. Good night.